The coronavirus pandemic has now been with us for 22 months, not to mention all of its variants. Many people have died as a result of the virus, which has also wiped out jobs and economies. Then it wasn't so bleak anymore with the introduction of the vaccines. That's also had its own challenges. Let's look at how the story has been unfolding throughout the months. Let's bring in eNCA reporter HeidiGiokos, who joins us live now. Good afternoon, Heidi. Unfortunately, another year has come and gone with COVID still with us. We've had two worrying variants, the Delta and now Omicron. Just talk to us about these two.
Yes, I think it's been quite a challenging year, not just for South Africa, but the whole world, because many were thinking, or hoping rather, that this pandemic would eventually come to an end, but it seems as though there is yet another variant. And I think the Delta variant that we saw earlier this year coming through and driving the country's third wave was very, very devastating. Not to say the other variants weren't devastating, but Delta seemed to be one of the most devastating variants that we had seen, especially because the country had not started vaccinating yet, and there was such a desperate need for oxygen and ventilators, and we saw many loved ones passing on because of this specific variant. And then a couple of months later, we were told that the fourth wave would possibly be here between the end of November and December, and true as those who said it would happen, it happened. And there was a new variant, Omicron. But the positive news and the silver lining, which I think we all try and find in the middle of this pandemic and this new way of living, is that it's a lot milder this time around. And it has a lot to do with vaccinations. It has a lot to do with the fact that it seems as though the variant might be a lot weaker and milder because of the vaccination numbers that we are seeing. But I mean, when you speak to health experts in Fundo and you just look at the year that was, many are saying that this is still going to be around for a very long time until everybody is vaccinated, because the more you vaccinate, the more the weaker this variant actually gets, and it doesn't provide room or space for the variant to become as deadly as what we've seen previously. And I just want to say that having covered COVID-19 for the past year and a half, 2 years, it's been extremely challenging to try and get people to really understand how variants work and mutate. And that, when we were so young, we were told that we weren't even given an option. We were told you were going to get vaccinated at school, and we would just know that it's going to be protecting us from severe infection, whatever it was back then. And it's very similar to now. So seeing all these variants emerge and mutate and develop, it can come to an end if people just vaccinate. So this is something that's definitely that I've definitely picked up covering this over the past 2 years.
And you've done an exceptional job, which is trying to unpack all that jargon. But then to the controversy around COVID-19, we also had a health minister resign due to allegations of dodgy contracts awarded. I know you covered that one as well. Talk to us about that.
Yes, I'll actually never forget that morning. It was 6 o'clock in the morning, not even, it was 5 o'clock in the morning. And our head of input, Faith Daniels, called me and said, "Get your bag ready, you're going to the Northern Cape." And I thought, why? And it was so suspicious because the health ministry back then had sent out a notice to say that then health minister Dr. William Kize would be visiting the Northern Cape and doing an assessment of the COVID-19 pandemic there. And it was almost as though it was very undercover and hush-hush. And when we got there, of course, top of the agenda was whether or not the minister then would resign or step down as the minister because of the allegations that emerged from the brilliant work that was done by Daily Maverick back then around digital vibes. So, we were in that conference room in the Northern Cape. We had pushed the minister, asked him several times in many different ways, are you going to resign as the minister, or do you not think it's fit enough for you to step down until you are cleared because of these allegations? We were in the middle of the pandemic. It was such a worrying picture. We were short of ventilators, we were short of oxygen, and the country had not been vaccinating as it should have then. We had the big issue around the AstraZeneca vaccine and then the Johnson & Johnson vaccine. So it was so worrying to see that somebody that we had all looked up to for so long as the face of this pandemic, trying to fight this pandemic, was accused of being at the forefront of this digital vibes contract. So it was quite concerning, but we did cover that contract, and of course the minister then had asked to be relieved of his duties after he was placed on precautionary suspension. So that was a huge blow to how the country was trying to fight the pandemic at the time.
And we understand that a legal matter is unfolding where he wants to prove his innocence pertaining that Digital Vibes contract. But then the vaccines, you touched on them. They've been a huge part of this year with SA rolling out vaccines only this year. Remember the bungle up at the beginning with those expired vaccines? It was just a mess at the beginning. Just talk to us about covering that.
Huge mess, Mfundo, and you know, you had seen many families so desperate to get their loved ones and their most vulnerable ones vaccinated, because we do know time and time again, and we've seen this through the data that's even emerging now, that vaccines provide protection against severe COVID-19 and possible death. So it was a huge blow for South Africa. We had all waited in anticipation for the vaccines to be delivered to South Africa. We had the AstraZeneca vaccine delivered with the president and all health officials at the airports, and then we were told later on that's not going to be effective against the variant that was driving the country's second wave. And then the Johnson & Johnson vaccines were put on hold because of the possibility of blood clotting. So the vaccine rollout was very slow in South Africa, and this is something that we saw across the African continent because more advanced and richer economies were able to secure these vaccines very quick. They were able to put the money down and say, this is how many vaccines we want, whereas the likes of South Africa and other African countries were unable to do that, and we were at the back. We were last in line to receive those vaccines, and our rollout started very, very late. In terms of those 60 and above, I think it was around the 16th or 17th of May that the vaccine started rolling out for that particular age group. And I remember for my particular age group, I don't want to give my age away, but it was very late in the year. So it was a huge blow because we were so desperate to vaccinate as many people as possible, as quickly as possible, and reach that herd immunity. And what's interesting is that government said by December, by Christmas, today in fact, we would have vaccinated at least 60% of the population, and we're not even close to that. So governments, of course, did try. They tried by all means to get vaccines as quickly as possible. But many would argue that and criticize the government to say perhaps it should have been done a lot quicker.
No, Heidi, great and informative stuff. You really had a good run this year in terms of covering COVID in particular. Thank you very much for joining us. Always a pleasure.